Welcome everyone to the Dental Oral Health Finalist Spotlight session of the 7th Annual Digital Health Awards. I'm thrilled to be joined by Mariya Filipova, investor in Convergence 4100DX. And we also have Dr. Daniel Kraft. He's CEO of NextMed Health and Digital.Health and one of our executive producers here at the Digital Health Awards. Today, you'll hear directly from the standout finalist in this important category, companies shaping the future of healthcare across the globe. I'm Bethany Boschert, the show director of the Digital Health Awards, and I'm excited to welcome you. This is my 4th year with Digital Health Hub, and it's been amazing to watch how quickly the digital health space continues to evolve, especially in areas like dental or oral health, to be honest with you. At Digital Health Hub, we're here to celebrate the innovators shaping the future of healthcare, like you. So thank you for joining us. Just a quick moment to introduce the Digital Health Hub Foundation, a 501c3 nonprofit behind today's session and the Digital Health Awards. We were founded in 2017 at UCSF with a mission to help the world's best digital health startups grow, scale, and succeed, ultimately improving healthcare delivery, access, and outcomes for all. Today, our community includes over 30,000 innovators from early stage founders, industry leaders, investors, payers, and providers. Throughout the year, we run educational programming, network events, and thought leadership series, all leading to the biggest moment, the Digital Health Awards at Health in Las Vegas. We celebrate the companies truly transforming healthcare. So we're proud to shine a light on this ecosystem and grateful to all of you for being part of it. Congratulations to our 2025 finalists in this category. Your innovation, passion, impact are helping shape the future of digital health, and we're proud to recognize your work on this global stage. So now I'd like to introduce Jason Saltzman, Head of Insights at CB Insights. Jason, all yours.
Hi, how you guys doing? I'm Jason. I'm the head of insights at CB Insights. We're a predictive intelligence on private markets and private companies provider, and we're partnering with the Digital Health Hub and Health the Conference to bring that predictive intelligence sort of directly to the conference experience, making it easier to navigate, figure out who you want to talk to, figure out who you should talk to. Hopefully for some of you guys as startups make you more discoverable as people that are innovating and driving forward the technological opportunities across the digital health space. With that, happy to find some time to connect either in Vegas or before or after. And really here to sort of set the stage for what a lot of you guys will talk about today, uh, giving an overview of the digital dental health market. So if we go to the next slide, I'm going to do the same thing I've done for almost every single one of these as I've teed it up. Please ignore the chaos on the left-hand side of this chart. That is 2021 and 2022 and the end of the ZERP era when money was free and investors threw it around like it was confetti. We should really focus on is the rise from the trough in 2023 to see the nice rebound coming up into this year, even at slightly lower deal volume. Right, we've seen rise in the value and the money deployed into digital dental health startups. That said, a lot of the companies that we have classified here are serving the dental industry, so I'll put a little asterisk there as opposed to specific digital dental health uh, providers, platforms, technologies, right? There's a lot of things that fall into sort of the general, what I'll call back office in terms of how they serve the digital health space, with dentists and dental practices being part of that. Um, Right. Specifically, two key segments we see attracting a ton of capital already this year are dental imaging analytics and dentist discovery and scheduling. Massive opportunities for both, right? One very much on the how dentists do or how dental imaging is done, and then the other on sort of how dentists can go and run their businesses more efficiently. When we look at, sort of unsurprisingly, the big hand wavy thing of I can just go like this and say AI, and point to the fact that that is likely going to change this sector as we know it. including a ton of the back office that I alluded to earlier and the actual practice of dentistry, right? We see that, things like Overjet are already driving massive clinical impact through AI, right? We see that the FDA clearances and other regulatory changes or updates are making it easier and easier to implement AI and new technologies in dentistry and other digital health domains. And that we're seeing a rise of integrations or sort of new solutions that make it easier to work with practice management systems, either sitting on top of them or integrating directly with them. Um, Generally, market dynamics, again, I'm going to wave my hands and say AI. Right, there's a massive opportunity. Everyone goes to the dentist, everyone has teeth. We're all going to sort of start to interact with our dentists somewhat differently, whether it's from scheduling all the way through to how the technologies that they are using work. Right, we see a massive pediatric opportunity is emerging, expected to grow by roughly 5 billion in the next 4 years. Um, as evidenced by Overjet launching their for kids segment. And then, right, we're seeing that a lot of traditional dental incumbents are struggling, right? We saw that Align had a slight revenue drop year over year. And then we're seeing that, there's more of a shift from standalone tools towards comprehensive platforms. Honestly, for startups at this point, that is more of a consolidation and exit opportunity than it is for, just like, oh no, I don't want to be a standalone tool. You guys coming into a market that is excited to start to consolidate. So with that, I'll hand it back to Bethany and let her get us rolling.
Yeah, thank you. Thank you, Jason. Okay, I would like to go over to Mariya Filipova, the investor in Care Convergence. She brings a unique lens to this conversation, combining deep healthcare expertise with a sharp eye for transformative innovation. So we're honored to have you here with us today.
Thank you. It's great to be here. I'm doing this for a second year in a row. It's great to see familiar faces. It's even better to be able to do this with my good friend Daniel Kraft. Dr. Kraft I have co-opted him reluctantly or excitedly. I don't know. The jury's still out to be part of our mission for expanding the definition of systemic health and converging oral health and overall health. So very excited to do this for a second year in a row, and very excited to do this with Daniel. Now, I'll give you just a bit of, Bethany covered my background, but I also want to make sure that remind the companies that both Daniel and I are here as a resource for you as you think about your presentations, your growth beyond this program. As an investor, I've gotten to know a fair number of you over the years. I will give an honorary disclaimer that my fund is an investor at Proclaim. I also serve as an executive in the company, so I have very gracefully recused myself from any voting when it comes to this year's companies, which I feel like I'm one of those proud mamas who is standing in the sidelines and looking at companies who, I look at OraQ, who was part of our Smile Health Accelerator the second year. I look at Different Kind, who is also very close, near and dear to my heart. So I don't get to vote this year, but I do get to cheer you on from the sidelines, all of you. So with that, I pass it on back to Bethany or Daniel. Do you want to do a quick intro?
Yeah, go ahead, Daniel.
Dr. Kraft. Yeah.
Great. Thanks, Mariya. Great to see everybody here. And yes, it's been great to conspire with Mariya on everything from X Prizes to the future of systemic health. And of course, I'm a traditional medical doctor, not a dentist, but I like my teeth. And I've been thinking about the overlap for a while. In fact, many years ago, I had this idea and even filed a patent on the 3D printed mouth washing machine, since I don't do a good job of that. And it looks like Proclaim is now doing pretty much along those lines. So one of the things I should have followed up on.
You're the original. You came up with the original idea. Somebody else ended up executing and bringing it to market. Yes.
Exactly. Ideas are one part. Execution is 99.9. So I'm Daniel Kraft. I'm a physician scientist by background, trained in internal medicine, pediatrics, hematology, oncology, and sort of been looking for the last 15 years or so at the future of convergent technologies, particularly around digital health. I'm the founder of Digital.Health, which is an easy website to remember, which is a platform to learn, share, and care, and find all the amazing finalists and 5,000 other companies and solutions in the digital health space. So the goal is to enable both sides of the market to find and leverage these tools. So the companies here are represented. If you're not, if you haven't updated your listings, please do so. And it's a great platform to help catalyze the future of digital health and medicine in oral care to veterinary care. I'm also the founder of NextMed Health, which is a platform and a community where we come together every year to look at this future of health and medicine across the spectrum, from dental to mental to psychedelics to chatbots to drones to where AI, of course, is taking all of us at its synthesis. So excited to be here today. I'm going to help moderate this with Mariya. We're going to hear from our four amazing companies, about 5 minutes each, to share a bit of their story, what they're doing, what's compelling about it. And then Mariya and I will tag team on a few follow-up questions. And then I think we'll have time at the end to have a bit of a discussion about the innovating in the dental oral systemic health space that hopefully will take us forward. So with that, I'm going to hand it over to Proclaim Health to share a bit about what they're doing, and I'll go from there. Over to Proclaim.
Great. Thank you so much, Daniel. Just to introduce myself, my name is Tamara Lindy. I'm the head of brand and integrated marketing at Proclaim Health. I will pull up a few slides here so everyone can take a look at our fancy product. Let me know when you're able to see my screen.
Okay, we got it.
Amazing. So what is Proclaim? We are your best oral health solution in just 7 seconds a day. We are a custom fit oral jet irrigator. And just to set the stage on why Proclaim came to be, there was this gap in the market. Obviously, we know that oral health is incredibly important. 85% of Americans agree with that, but only 30% of those people are actually flossing, and 5% of those are flossing effectively. So what does that lead to? Widespread periodontal disease. We knew that there was this gap in the market of an at-home solution that was custom, and that is how Proclaim came to be. So what we are is, as I mentioned, a custom fit oral jet irrigator that delivers a complete mouth clean in just 7 seconds a day from home. So over here we have our product. This is the brains of it. It's that mouthpiece. You go to the dentist and get a 3D scan done of your mouth, and we 3D print this mouthpiece that has up to 60 jets that clean in between your teeth and below your gum line. It pulses 22 ounces of water through this reservoir here, and you are able to switch out mouthpieces for different members of your household. We also have oral infusion concentrate, which is this minty fresh solution that you can put in your system there just to help continue to fight bacteria and freshen your breath. So we did a clinical study where we compared Proclaim to people using Proclaim and a manual toothbrush, and those using a manual toothbrush and floss. And we had some amazing results with 82% reduction in gum bleeding, 41% reduction in gum inflammation, 34% in plaque buildup, and 23% in pocket depth. And this was in just 30 days of monitoring 192 double blind as part of this study that we published in Compendium. So we really knew that we were onto something when we started seeing these amazing results come in. We do have a wonderful scientific advisory board. And the real point to touch on here is that we are, there's no secret that poor oral health is linked to a number of systemic diseases, from cardiovascular disease, diabetes, Alzheimer's, and overall systemic inflammation. So we wanted to speak to the smartest people in their areas and just get to know more about that whole connection between your mouth and your overall health. So I should probably stop there. I believe I'm at 5 minutes, but that is where we have been focusing our current product.
Fantastic. I need one because I don't brush enough or floss enough.
You're gonna love it.
What have you found has been, you need to have a dentist involved to do the scanning. What are the barriers and workflows to incentivize the oral care community to plug this in? Because it may end up with customers who don't come back as often for their teeth cleanings, or they don't have develop as many caries.
Sure. So as of right now, yes, you do need to have that dental practice involved. And honestly, the dental practices have been raising their hands to become part of our system. We have over 800 dentists across the country, and that's with little to no outreach. We started in California only and have branched out, and now we are in all 50 states with dental practices that are eager and willing to scan. So right now, that has not really been a barrier, but we are, of course, looking into all different options for the future of the product and how we can expand getting the scans into to us without, we'll see where the future lies. But right now, that dental piece is a really important part, and we're very proud of the partnerships that we have with dentists all over the country.
Mariya, you're an investor in this great company. Any perspectives from that?
Oh
from the
boy,
investor
do I have
perspective?
perspectives. Maybe I'll ask it as a question. Yes, Tamara, how is this different than a standard water pick?
The customization is the big piece. So the mouthpiece fits your mouth and no one else's. As I mentioned, it ups to 60 jets and it cleans in between your teeth and below the gum line in 7 seconds. So a normal water pick, you would have to aim it in the right place. There's all that guesswork. Am I doing it right? Then there's the whole population of people that have dexterity issues and may not be able to get to those back molars. And, there's this question of, am I getting all the debris out? So with this, there's no guesswork. You essentially just put it in your mouth, press the button, and you see it working. You actually see it come out into the sink. There's no mess, comes right out from the back of the mouthpiece, so there's no splatter. You always hear about those horror stories of people that end up getting the water all over the sink, and that's not an issue with Proclaim. So the customization is really the piece that sets us apart.
It's impressive.
And I'm just on the space of new forms of oral hygiene. I've seen a few versions of what look like mouth guards. Some vibrate, some might be a Sonicare type element. Are you compared to others, and how do you parse the competition broadly?
I honestly wouldn't say that we are compared to any others. There are other companies that are doing other types of mouth cleaning. I also can say that our product roadmap is very deep, and I'm very excited about the future of the company and what we have in store. But right now, I'm proud to say that we truly are the only custom fit mouthpiece that is able to give that whole mouth clean.
Clinician, and could you maybe just for we say oral health is overall health, but this product in the context of an overall care plan, where do you see this product fitting most tightly in the overall clinical workflow or patient workflow? So you have the customers and everybody who is worried about performance, longevity, people who are good flossers, they want to be great flossers and want to do something for their mouth. And maybe that's one segment of the population. But talk to us a little bit about the clinical utility of this product and what patients it might benefit the most as part of their care plan.
Sure, that's a great question. I mean, integrating Proclaim into existing care pathways is really the path forward. That's through medical practices, dental practices, DSOs. And then, our goal, obviously, at some point is to get involved in dental and medical benefits. So the goal there is to reach patients at their most receptive moments, and that's through the recommendation of trusted professionals. So truly that combo of the clinical endorsement, hopefully insurance coverage, and the at-home adherence would really accelerate our adoption. But talking about specific patient populations, it's everyone from, cardiovascular disease, periodontal, Alzheimer's, diabetes, special needs. There's a whole, patient population there. So right now, as a company, we're actually spending a lot of time digging into these patient populations. We took a bit of a pause from our selling direct to consumer and through our dental channel, and that was done very strategically. We wanted to really lean into these patient populations and see how they could benefit most from utilizing Proclaim, whether that's someone undergoing chemotherapy or other types of treatment can Proclaim help get rid of the bacteria that's in, their mouth and truly help with these type of treatment plans. So right now, we're putting a lot of emphasis on trying to build out some studies on those patient populations.
Great.
Thanks, Tamara.
Thank
Exciting to
you.
watch that evolve.
Everybody, yes, ask your clinician about Proclaim. That's right.
Over next to OraQ AI.
All right.
Hey everybody, yeah, thank you. We're super excited to be here as a finalist, and congratulations to the other finalist companies as well too. Great to see some familiar faces again here. I'm just gonna share my screen here as well. 1 second. Perfect. Can you guys all see that okay there? Excellent. So yeah, my name is Dr. Amish Khanna, the CEO and founder of OraQ AI. We're really excited about what we're building to transform dentistry, which is a clinical intelligence platform that unifies fragmented dental data so we can deliver better patient care and drive scalable practice growth in the dental industry. We have a simple vision at OraQ, which is to make every dental visit a step towards better health. With smarter data-driven insights, we can help dental teams plan the right care at the right time for the right reasons. So, bit about the problem, about what we are solving. For us, it's really about the silos of data that every time a patient sits down in a dental chair, we have to look at up to 6 to 10 siloed data sets to come up with a diagnosis and an effective plan for our patient. And does everybody look at those? Does everybody have those technologies? Does everybody know how to dig into each of those specific diagnostic sets? That's where the provider variability comes in. And if we look at the emerging and continued group dentistry trend, there's an 80+% chance that the next time you lay down in your dentist chair that you're going to see a different dentist or hygienist all in the same practice over the next 3 to 5 years. So you put these two things together, and that's leading to suboptimal care, and it's actually leaving a huge dollar lost opportunity of untapped or missed opportunities of care up to $1 million a year on the table. So what we built at OraQ is a clinical intelligence layer that we can really bring all these siloed data sets together into one place, align providers so that regardless of whether you're seeing a new graduate, a seasoned doctor, a specialist, a generalist, you get the mind and the wisdom of 1,000 dentists at every visit. And we can give real-time risk insights and treatment plan recommendations to clinicians so that they can really optimize a patient's health. So from a technology perspective, we've really brought in a lot of different multimodal data integrations over the past few years since we started our journey. And also excited about, for the first time here last month, we were at a Connectathon, and actually one of 2 dental companies for the first time ever to actually do a medical dental data integration. So we've now connected with Epic, and we were working with key stakeholders from the American Dental Association and dental leads at the firm and the DoD, who said, hey, we got to bring these 2 things together. And we showed a data transfer between OraQ and Epic, and we connect into major dental electronic medical records as well. So this is just the beginning, but exciting times when it comes to really driving the medical dental integration. From what does our platform look like? This is a quick little snippet of what we call our wellness profile. So with one click, we extract a ton of data that we can get our hands on, give a clinician, whether it's a dentist, assistant, dental hygienist, risk information where now they can see why is the patient in green, yellow, or red. How do they understand what that means to them, and what does that mean to communicate that with their patient? And if it aligns with the chief complaint, what do I even look at and dig in deeper so we can create a really standardized assessment and show this to the patient as well. So the patient can see this, the patient can walk away with this in the palm of their hands and really start bringing these key data sets together all into one place to drive true meaning and better care. Our unique value proposition has really expanded and grown from when we started the journey. It was really about how do we drive value for the dental practice and the patient. And our standardized assessment has shown that we can uncover up to 2.5 times increased treatment opportunities from every dental exam. And we're talking about ethical opportunities of care driven by early intervention and prevention. So really, why should I do something now or wait? But where we've expanded to over time here now is really this partnership first approach has been a big part of our journey to say other partners who initially maybe thought we were a competitor now are saying, hey, we could be an additional value add. embed certain parts of your solution into ours, create real-time intelligence within our solutions, and then open up the door for users to get more and more through OraQ. And then this broader dental medical ecosystem that we're working with University of Pacific now, Tufts Dental School on AI education, and then what I shared before about the medical dental connection as well. So it's a bit about our journey and what we've been up to.
Fantastic. It's great to see it's another intelligence platform that makes the decisions and the dot connection between integrated care plans second nature. And so congratulations on all the amazing progress, Amrish. It's phenomenal to see in the last couple of years only. Tell us a little bit about the adoption curve as you talk to dentists looking to adopt your solution. This is not the way they're taught to practice dentistry in dental school. So tell us a little bit about feedback from clinicians on adopting your solution and some of the more surprising sticking points, if there are any, as they try to wrap their head around how this integrates in their workflow.
Yeah, great question, Mariya. And it's something that was a big part of our journey, especially in the past year of going live into market, because what we found is what clinicians say they want to buy and what they want to use versus what they actually use sometimes is different, right? And we're not taught that to work and stop within a workflow for a moment and utilize a clinical decision support tool while we're just trying to dig in quickly and talking about our patient and got to run to the next one. And so what we found was, the individuals really wanted the standardized approach, the full comprehensive assessment that we were offering. But when it came to using it, is how do you simplify this and give me a quick and easy starting point? And that's where we really brought a lot of that functionality all to one place, which is the wellness profile that I was showing before. And also learning through that journey that as much as clinicians will say sometimes we all understand risk assessments, we all don't really understand risk assessments, and we might not know how to talk to the patient about it. So giving those tools that, like, okay, this patient's in the yellow, like, why is this patient in the yellow right now? Just give it to me quick and easy. How do I even talk to my patient about this? Give me those tools and easy ways to communicate that. So we found that was the starting point for the journey, and then they can get immediate value, start driving better care for their patients, and then grow into the deeper aspects that they might want to dive deeper into medical or sleep or whatever it might be. But how do we support everyday dentistry with 4 of our 7 models, which is periodontal, so gum health, cavity health, your bite, and cracks and wear patterns in teeth. That's everyday dentistry, and then we can kind of build from there. So that was a big learning. And the second big learning, which is really what drove us into this partnership first approach going forward, is that there are existing solutions that they're already used to stopping and using. Well, how can we drive value within those or other platforms that they're used to using today, and then expand to the other parts of the solution later?
So speaking of everyday dentistry and the theme of systemic health and dental health is oral health is human health, and you mentioned integrations with Epic. How do you see the art of the possible today and what's next to integrate? Maybe you could do a blood pressure while you're there, or hemoglobin A1C, or pick up some other digital biomarkers, because as a lot of these things are cross-connected, is there an opportunity to cross silos and blend them together with your platform and others?
I think absolutely. And the premise of our platform is how do we give simple and easy to understand meaning to data, right? So that I don't have to be a dentist that deeply understands medical information to be able to look at a medical report and have to dig through it and then say, okay, what does that mean for my patient? Help me give me the quick of what I need. Vice versa to a medical physician as well. They're busy. They're really working in whatever specialty area they're in. If there's something relevant from oral health perspective, how do we just give it to them quick and easy so they don't have to go and educate themselves right away on what those things mean, but they understand, okay, this patient is again in a green, yellow, or red in this specific area. I should incorporate a dental visit as part of my plan, or vice versa. As a dentist, we should send the patient to their general physician to get evaluated because we're seeing other markers that are putting them in a higher risk category. So what I'm really excited about, just to finish on, is that the medical dental integration is something we're taught, in dental school. But technology now, I think, is really enabling the ability to finally actually achieve that, because we don't have to, I don't have to send you a thorough document report, Daniel, right, that you're going to see and not have time to read. And you might send me something back or a report, or I get something that I don't understand either too, because it's not my domain of expertise. But if we can do technological integration of those key points, right, back and forth, those are easy points that start that process where we can start co-referring and really, I think, building that collaboration more seamlessly.
100%. Great. Well, keep up the great work. Congrats on being a finalist. We'll look to see where this evolves, and
Thank
stick around
you.
for the rest of the discussion. Over to different kind.
Let's go.
Awesome. Thank you, Daniel. Thank you. A couple things. I don't know why my screen background is backwards. So I have.
No, it's perfect. We
It's
see you.
perfect.
Does it look
Right
normal
way.
on your end? Okay,
It's
cool.
only for
Yes.
you.
All right, cool.
Yeah.
I was like, I don't know why it is, but that's all right. Great. And then Daniel, one thing about Digital.Health, I went on there and I know that there's dental companies on there, but I looked at the specialties piece, and you got veterinary on, but there's no oral health like when you just like scroll down from specialties. So maybe an opportunity there to even drive more.
Daniel, I did not pay Matt to ask you that question. I can tell you that I am not buying him coffee after the session.
100% not. So I had to like dig a little to like, are there actual dental solutions on here? So continued opportunities for all of us, right?
I think what the intention there, Matt, is I'm just going to plug in here. If you guys remember a couple of years ago at Health, the conference, there was no mention for dental. Then 3 years ago, we brought in the dental pavilion, the oral health pavilion, and there was a half a day section in the agenda on oral systemic health. And I was very excited to be able to do that with health. Fast forward 3 years now, dental doesn't necessarily exist as a half a day session at the end of the program. It's embedded in the panels, in the talks, in the overall curated program. So I think Daniel is just putting all the dental companies as part of the digital health category. I'm giving him wink, wink. I'm giving him some credit. But it's the intention is to, I think, to have oral health intervention in diabetes management, or oral health intervention in prevention or longevity or dementia. So
right. No, I'm just ribbing you too. I don't really care. It's
no,
obviously your
it.
platform. You do what you need, right? But
no, bring it. I love it.
There you go.
By next week, there will be Digital.Health/oral health, or
Yeah.
watch that space.
Just making things happen here on this webinar. I love it. Awesome. Well, it's great to be with you all, friends, colleagues, people that generally really appreciate being around. So, and today, no exception. Happy to represent different kind and what we're doing in the oral health marketplace right now. And I think ultimately what we see in dentistry is that there's a big data infrastructure gap. And that's come from a lot of different reasons, right? In terms of how, dentists charted on paper for way longer than they did in medical care or whatever. But then a lot of what comes out of a dental visit and gets transmitted currently to, payers and to other things, right, is only claims data. It's really claims focused. And so as I share my screen here, right, this is what we might see coming out of a PMS in dentistry. It's some procedure codes, some D codes. We don't have diagnostic coding. And really that's just related to dollars, right? Like this is how the dollars flow in dentistry. And unfortunately, dental payers and organizations, so DSOs, groups, practices, don't have enough precise data to ensure that you get the desired experience and outcome that you want when you go to the dentist. I think for many of us, myself included, I don't love going to the dentist. I feel like I get told what to do. I had one person tell me one time, they're like, it feels like I'm going to the principal's office. And you're like, yeah, that's kind of true. It's kind of sucky. And dentistry definitely has this stigma of being a place where they just kind of tell you what to do. And that has not changed, I don't think, with a lot of technology. It's like you have a cavity, you need a filling. And we don't listen to people, we don't involve them, and that leads to bad experiences, that leads to people not coming back, that leads to poor oral health outcomes. And so what we have built in terms of, there's a lot of data infrastructure problems that we can solve, but the first product that we have built is really to actually help people share their experiences on what matters most to them in real time, to give back that information to the practices and to the payers to help them optimize on the things that matter most to patients. And so ultimately, that leads to better care for patients. It leads to more aligned incentives on the payer side, and it leads to dentists actually knowing what their patients think and can actually do something about that. And so what that really looks like then is we collect the data from the patient after their visit. So we send them a text message. It's pretty simple. We have great response rates. Press Ganey just got acquired by Qualtrics a couple days ago, $6.5 billion, right? Like, this is not a small market in the medical world, but they don't really touch dental at all. And so, we see, all right, cool, we can, have better response rates than them. We can get more data because we're dentists first and we know what dental workflows look like and how to ask the right questions and do all the right things. We collect that data specifically from the patients about both their patient-reported experiences and their patient-reported outcomes. And then we give that data back to the DSOs, to the payers, to drive impact, to help them do the next right thing. And so whether that's, scorecards for an exec, whether that's, a next day huddle plan for a practice manager at a practice, or whether that's working with a payer to help them create, hey, how do we optimize this network and create a pay for performance or pay for value program within that network to actually drive better care? And then ultimately, how do we get that data transparently back to the patients so that when they're going onto a insurance directory and are making a decision about care, they can actually choose a provider that aligns with their values and they can see more than just a name and an address and perhaps some credentials. So that is what we do. When we put it into practices, we see these kinds of things. Now I actually have insight into why my practice is struggling. And we see 63%, treatment plan increases, and we see 23% increases in monthly production. People are doing better in the dental offices because they're able to meet the patient needs where they are instead of, hey, this is the way we've always done it. And people come and they nod their head and they walk out and they never come back. So I will shut up right there. Happy to answer any questions. But yeah, that's a different kind.
Congrats and amazing on that. Are you, let me be a little bit Pollyannish and cynical about this. Do you really want to know what patients think? Are you hearing things that are a little bit surprising or, not to put anybody on the spot, but some providers just might want to say, I saw Mariya for a filling, completed the filling, billed for the filling. I may not see Mariya again. Why do I care? Yep. So just walk us through a little bit of like that philosophical question. Why is it so important that we actually hear from patients and self-reported outcomes?
Yeah, that's great. I mean, I think there's a couple good things to talk about there, right? And first of all is like, we don't sell it to everyone right now. We don't really have individual dentists on the platform because we've literally heard from them. We have had them, right? And they're like, I was crying when I saw this at night because I put my heart and soul into this. And you're like, well, you have a pretty big ego if you can't like listen to someone say, hey, like, here's some feedback about your practice, right? Like, you're pretty fragile, I think, in that moment. And so, we sell to larger DSOs, we sell to payers, we sell to people who have the ability to take this data to a much larger level and to make it standard. And then I think it will flow down to those private practice dentists as well, right? Especially when the reimbursement models are designed around this kind of data. So I think, that's what we've seen certainly. And that's what we've learned is that, hey, our go-to-market strategy is not sell to an individual dentist because there's a lot of them. It's no, like, let's sell to the people who can actually make the changes. And, I think we're doing that, right? I mean, we're on track to 10x the company, like in 12 months, this year. Like, we're doing a lot of good things with a lot of the right people that I think are making a meaningful movement. So, but your question though, I think is a relevant one, Mariya, too, in terms of, let's talk about outcomes. Like, where is outcome measurement in dentistry at all, right? It doesn't exist. You walk into any dental office, like, what percentage of your patients have cavities? They can't give you an answer. Like, that would be unheard of in a medical practice where you would say, what is your patient's average A1C? Like, how many of your patients have diabetes, right? Like, they know those answers because A, they get reimbursed based on those kinds of things. And B, like, it's the standard that they learn in school and all of those different pieces. So I think even from an outcomes perspective, it's a proxy, right? It's its ability for us to say, hey, based on OHIP 5, here's your overall oral health, your function, your pain, your appearance, right? Like, we can start reporting on that stuff. And that's what we're doing with payers, is to be able to say, cool, here's the actual overall health of our member population, right? So I think it's the first step of many in how do we actually get clinical outcomes within dentistry to be a standard.
Yeah, and
Last quick question.
Mechanism. Yeah, Daniel, maybe it's a signaling mechanism too, because it's intentionally setting up the dentist-patient relationship to be a longitudinal one. It's not an episodic, I have an acute issue, I need to get it taken care of, and then 5 years later, I'm going to go back again when I have an issue or pain. So that's the signaling mechanism that I think is really important. We don't miss out here. Sorry, Daniel, jump in.
Just last quick question briefly. You get what you measure. You can measure all sorts of things in oral health and mental health and all sorts of health. Is there a bit of a FICO score for oral health aside from caries and gums? Is that something that can be an overall metric going forward?
For sure. Yeah. I think what our hope is, I'm going to say is twice in a row there. So what our hope looking forward is that dental practices, dental payers, and ultimately patients can look at this kind of data and say, oh, that's something I can trust, right? This is this third party that plays nicely in between that kind of triangle of payer, provider, and patient. And that's a fraught sandbox, right? And so we need some sort of validated third party solution that says, hey, here's what it looks like to go to this dentist. Here's the outcomes that come from here. And here's how we build the reimbursement models based on that data.
Perfect. Great. Thanks so much, Matt. Stick around for the last end part, and we're going to go to our final finalist, which is Great Gums.
Last but not least, yes. Kick it off, Great Gums. Yeah.
Hi, everybody. My name is Ben. It's great to meet you all. So I work with Mark and Young at Great Gums. I'm the head of growth. Quick note, French accent here. So, if I need to repeat myself, please, tell me. I'm also a rookie, right? This is my first time doing this. So please bear with me. I don't have any fancy slides, but I do have a very fancy innovation, which I'm going to actually preview on this call. And that's pretty cool.
Wow.
So I'll actually get started with a question. What's the number one cause of tooth loss in adults today?
I think I know the answer to that one. It's caries, isn't it?
So it's funny because most people think, it's cavities, and actually it's gum disease. And the scary part is that 1 in 5 adults in the US, have gum disease and they don't even know about it because it's silent, it's painless, it's invisible until it's too late. So we really believe that gums are the foundation of your smile, right? They hold your teeth in place. And Great Gums plays a big part here because the entire industry is obsessed with whitening teeth, fresh breath. But we look at gums as really the medical foundation that keeps your teeth strong and your health. And that's really where our technology comes into place, which is bioelectricity. I'm sure you heard of it, right? Your heartbeat, that's bioelectricity. Your brain telling to move your hand, that's bioelectricity. And that's the beauty of this technology. It's been used in the medical field for decades, right? Pacemakers, wounding heals, even cancer, but not oral care, not yet, until Great Gums, at least, with the first bioelectric toothbrush. So our technology sends about 10 million biocompatible microcurrents per second. So unlike most toothbrushes today, it doesn't just break down plaque. It stimulates blood circulation in your gums, and it supports the natural healing process of gums as well. The best part about it, it's completely undetectable. It's microscopic, painless, safe. So we really believe that we are the state-of-the-art oral care tech at this point. And our latest product, which I'm going to show you in a second, called Sonic Gums, combines bioelectric technology with sonic power, giving you the best of both worlds, right? Deep clean plus, gum healing. Give me a sec so I can show you a preview of the tech, if I'm able to do that, because I'm also not a Zoom user. Give me 1 sec. Just want to show you a few images so you can see our baby. Can you see it? Okay. Okay, amazing. All right, so but I'm talking about this, but we actually have real proof points here. We conducted clinical trials at Columbia University, and bioelectricity showed to reduce gum inflammation by 75%. This is the biggest stat in the industry in that respect. But also gum bleeding, 60%. So we have real results, real healing, and real prevention. It's a perfect product for sensitive teeth, receding gums, aging gums, and again, most of the population has that, right? So it's a real and, in my opinion, perfect alternative to, you know, abrasive technology, brushes, or even water jets. Sorry, Proclaim. You know, that can really, you know, irritate your enamel and your gums too. We've had massive success with older millennials, Gen X, and boomers for that specific reason. And as you guys know, beyond oral care, we're also talking about total health here, right? Gum disease is actually, the gateway to serious health complications. Why? Because, when your gums break down, bacteria enter your bloodstream directly through your mouth. So again, gum health, total health, dental longevity, but also, full body health. The best part about this product is that we're actually, accessible to everyone. The way we are priced, right now, we're going to. So right now, our products, our beta product, is actually, below $20. But Sonic Gums, the new product that you're seeing now, we're going to go to market, around 70. So it's actually very competitive to a Sonic Air. And we don't have any apps. There's no AI gimmicks. It's just a toothbrush that really lets you brush smarter and not harder here. So yeah, we really believe that we are the biggest innovation in toothbrushes since Sonicare for these reasons. We're not just cleaning teeth, we're healing gums, we're preventing disease, and we really hope to be changing lives. That will be it.
Fantastic. Yeah, great innovation. I've had the early devices, and I always thought, wow, I also have a Sonicare. How do I compare the two? And now it looks like you're blending those together. You mentioned the clinical trials. Can you summarize about how those are done, at least with the the light part alone, compared to, let's say, a normal brush, and what the evidence there is to support the impact?
So the clinical trials were conducted for bioelectricity specifically, not the new technology that combines both. But we are undergoing, clinical trials with the ADA actually, when it comes to that specific tech.
Okay. I like the friendly back and forth and the friendly competition. So Benjamin, two questions. Number one, we have 9 minutes, plenty of time to litigate this and get to the bottom of this, okay?
Yeah.
What is the mechanism of action, right? You did, I think it's important for those who are listening and looking at the technology to understand that this is microcurrent. It's not at a frequency that would harm the human anatomy in any shape or form. It's a safe frequency that is effectively the same frequency of the brain waves and the heartbeat. So
I think where we're starting to see the shift.
Yeah, maybe. Could you just give us the mechanism of action of why this microcurrent, when applied to the gums or the teeth, is actually effective in doing all the things that you're claiming you're doing based on the clinical trials? And then let's go back a little bit. I want to make sure that Proclaim also has a way to, if we have a technology using bioelectricity to be your toothbrush, you mentioned something around inflammation and irritation from flossing. Let's just get the perspective on what are, if any, side effects to these approaches.
Yeah, wow, there's a lot to unpack here. So, I'm not a scientist, but the scientist in the gang is young. But if you look at, bioelectricity, it's essentially it's electric signals that help communicate and heal around your body, right? So our technology stimulates these microcurrents, which are biocompatible with your mouth, right, with your organism. So that's why you don't feel them. The beauty, so they're undetectable. It's again microcurrents because they're at the microscopic level. They are very powerful, but you cannot feel them. What's been very interesting with the first prototype that we launched is that there's a paradox in the sense that when you talk about bioelectric or electric or sonic or any kind of advanced toothbrush technology, Americans do expect some sort of sensation and experience, right? Because we are used to electric toothbrushes, we're used to sonic brushes, we're used to jets. And I think, that was sort of like a key learning for us is that, even if we have a very strong innovation, that is changing the experience and making it much easier for folks with real issues, like, again, recession or sensitivity. The market has been wired to expect a different sensation. And the reality is that people are very loyal to their dental products, whether it's their toothpaste or their toothbrush, for a specific reason, right? So we're like, let's just take a step back here, because we proved that the technology works, and clearly, there's this huge market for us. Again, like older millennial, Gen X, again, the aging population. But they've been using these products for decades. So why don't we, bring, the best of both worlds into, one tech, so they can feel like, they're still, cleaning their teeth, but at the same time, we really help them, repair their gum lines at the same time.
And it's not abrasive. It doesn't use the mechanical force, so it's actually gentler on the gums and the teeth.
Yeah.
I'm going to give 1 minute to Proclaim to give us a point of view on irritation from the water jets. And then I know that I'm going to be in trouble if I keep this any longer. So to be continued, for those of you who are listening, please reach out and give us comments and additional questions. Tamara, any thoughts on your end?
Sure. I mean, the first point I'll make is it's great to hear about companies like Great Gums that are, putting the emphasis on moving dental health to preventative rather than reactive. And I think that's a, really great point. So I'm so glad to hear about your company. And obviously, as I mentioned, gum health being so incredibly important. The great thing about Proclaim specifically is that because of the customization of the mouthpiece, each of those jets are hitting the exact right spot. And we have, technicians that place them according to your specific dentition from the 3D intraoral scan. So unlike a water flosser or, manual floss where you might be getting those micro tears as you're attempting to get in between your teeth, Proclaim is super gentle on the teeth and the gums, and each of those is positioned in a way so there is no irritation there.
So for those of you listening, please use both. Please
Right,
use
exactly.
Yeah, no, exactly. They're totally,
toothbrush, make sure you've got, you're flossing one way or another, you're taking care of gums and teeth.
That's why it was so important for our clinical study. When we did it, we had Proclaim with toothbrush and then toothbrush and floss on its own. We would never say just use Proclaim and don't support your toothbrushing habits. So it's a really great point, Mariya.
So thank you everybody for doing so great. Make sure you mark your calendars for Monday, October 20th, where we crown our winners live across 4 stages at Health in Las Vegas. The schedule's here, but it's also on our website under 2025. There's a tab called Grand Finale Agenda, and I've put an add to calendar on each stage, so you can put that in your calendar by clicking there. Don't forget to join us afterwards at Chica and the Venetian, where DJ Klasko will be spinning some records, he said, from Taylor Swift in yesterday's calls. That's from 6 to 9, and we'll toast the winners and celebrate with the entire digital health community. So thank you, everybody. Have a great day.
Amazing. Thank you. Great to see you,
everybody.
everyone.
Thank you. Bye, everybody.
Bye.